All right, folks, let's talk about cardiovascular emergencies. Review of the circulatory system, anatomy, and physiology. The following is a brief review of the anatomy and physiology of the circulatory system as it pertains more specifically to cardiac emergencies. The circulatory system. The circulatory system, also known as the cardiovascular system, has three major components. What are those three major components? We have the heart, we have the blood vessels, and the blood itself. The three major components of the cardiovascular system, which is also known as the circulatory system, is the heart, the blood vessels, and the blood. Now, each of these components may play a significant role in the patient's experiencing a cardiac-related emergency. The conduction system. The heart is more than just a muscle. It contains specialized conductive tissue, the cardiac conduction system, which generates electrical impulses that are conducted rapidly to other cells of the heart, a property known as conductivity. The heart also contains specialized contractile tissue that allows the heart muscle to contract when stimulated by the electrical impulses from the conduction system. Conductive cells are grouped in three areas, people. Conductive cells are grouped in three areas of the heart. Pacemaker sites, which is one, where the electrical impulses are created automatically, independent of the autonomic nervous system of the body, a property known as what? Automaticity. 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 One pacemaker site is the sinoatrial node, which is also known as the SA node, of course. Sinoatrial node, located in the upper portion of the right atrium. The SA node is in the upper portion of the right atrium in the heart. The SA node, known as the primary pacemaker of the heart, generates the impulse that triggers the rest of the heart to contract. A secondary pacemaker site is located at the crux, or CRUX, however the hell you say that, crux, the point where the walls that separate the upper and lower chambers and the left and right sides of the heart all cross. It's a conjunction. This pacemaker site, the atrioventricular node, or AV node, only creates an impulse of the sinoatrial node let's go back. Rewind. This pacemaker site, the atrioventricular node, or AV node, only creates an impulse if the sinoatrial node fails, or the SA node. So it's like a backup. The AV node is a backup to the SA node. If the SA node fails, the AV node kicks in, and you still kicking, baby. Staying alive. The final pacemaker site is widely distributed in the conduction system of the ventricles and is known as the Purkinje Fibers or network. Purkinje Fibers or network because, they branched out. A network of fibers. Think about it. These fibers deliver the impulse to the working cells of the heart. If both higher pacemaker sites fail, which is what? What are both higher pacemaker sites? Yeah, shut up. Anyway, the SA node and the AV node. God damn, come on, man. If both higher pacemaker sites fail, which is the SA node and the AV node, the Purkinje network can also initiate an impulse to maintain some ventricular contraction. So you got three things that'll help your ass stay alive until somebody gets there to help you further stay alive. The heart's electrical impulses travel through the heart from the pacemaker sites via a conduction pathway that is composed of cells that neither initiate an impulse nor contract. Instead, the cells of the conduction pathway rapidly conduct each impulse to the rest of the heart muscle. They do this in a unified fashion so that, rather than the whole heart contracting at once, there is a sequential contraction of the chambers. They all in together. They in rhythm. In addition to the conductive cells of the heart, there's another group of cells that are often called the working cells of the heart. Let's put quotations on that, working. The working cells of the heart, all right? Also called contractile cells. Their primary purpose is to contract in response to the electrical impulses provided by the conduction system, okay? So the conduction system, of course, conducts the electricity that the heart needs. And then the primary response or purpose, of the working cells of the heart, which are called the contractile cells, is to what? Contract. So they get the electricity and then they contract. You need the electricity to contract, all right? These working cells have characteristics of both smooth involuntary muscle and skeletal voluntary muscle. Like skeletal muscle, they contract strongly when stimulated to help eject blood from the heart. Like smooth muscle, they contract completely, so they don't do shit halfway. They contract completely, all right, just like the smooth muscles, to a very small size, because the heart has to collapse upon itself in order to push blood out of the chambers. That's self-explanatory. Nothing to break down. The conduction, the conduction cells and working cells operate together in unison to fulfill the heart's sole purpose. What is the heart's sole purpose? You got 2 seconds. To pump the blood, all right? The heart's sole purpose is pumping blood. Remember that. The heart's activity is monitored by the body to ensure that it is meeting the body's blood flow requirements. If the heart's activity needs to be modified, assistance is provided by the autonomic nervous system. Although the heart initiates electrical impulses on its own, the overall heart rate and force of contraction can be influenced by what? The autonomic nervous system. Why? Because automaticity is automatic, all right? The sympathetic branch of the autonomic nervous system innervates all 3 pacemaker sites and the working cells of the heart. So, yeah, all right. When the body needs increased blood flow, the sympathetic nervous system is stimulated and causes the heart to beat faster and with greater contractile force, which increases the ejection of blood. The parasympathetic branch of the autonomic nervous system innervates the sinoatrial and the atrioventricular nodes, the SA and the AV nodes. When the parasympathetic nervous system is stimulated, it slows the heart rate and eases the force of contraction. This diminishes cardiac output in situations where strong output is not needed. For example, while the body is sleeping or at rest. The heart. The heart consists of 4 chambers. The atria, you have 2 of them. The 2 top chambers, those are the atria or atrium, right and left atriums, all right? Atria. Don't forget that. Don't sleep on that. And the ventricles, all right? The 2 bottom chambers, the ventricles. What do you have? Right and left ventricles as well. You got the right and left atriums or atria, and you have the right and left ventricles, all right? As mentioned, the heart has only one purpose. You already know what it is. I'm going to give you 2 seconds to answer that. Pumping blood, damn it. The heart's sole purpose is to pump blood within the body. If that single purpose is interrupted, even momentarily, cardiac arrest ensues and the chance of survival is slim. The right atrium receives deoxygenated blood from the inferior and superior vena cava. Don't get caught up on these words. Google some etymology and put them in and break them down. Break it all down. The right atrium receives deoxygenated blood. So the heart receives deoxygenated blood through the right atrium. That blood is coming through the inferior, which is the upper portion, and the superior, which is the lower portion of the vena cava. All right? The largest veins within the body. That's what the vena cava is itself. It is the largest veins within the body. Upon contraction, the blood in the right atrium travels through the tricuspid valve. Don't slip on that word. Tricuspid. All right? It's 3. Three. All right? 3 cuspids. All right? Break that down. Tricuspid valve and into the right ventricle. The right ventricle is below the tricuspid valve. And the right atrium travels through the tricuspid valve and into the right ventricle. Hold on, I think I messed up. Okay, no, I didn't. No, I didn't. Anyway, moving on. From the right ventricle with the next contraction, the deoxygenated blood is ejected. Remember also, deoxygenated blood is on the what? Right side. Deoxygenated blood is ejected through the pulmonic semilunar valve and into the pulmonary arteries. All right? The pressure in the pulmonary vessels is very low. Thus, the right ventricle does not have to generate a great deal of force to eject the blood. In some pulmonary lung diseases, or pulmonary diseases, because pulmonary is lungs, all right, directly related, such as emphysema, however, the pulmonary vessels are compressed or narrowed. This increases the pressure in the pulmonary vessels and makes it more difficult for the right ventricle to pump blood out. If this high pressure is sustained over time, the right ventricle begins to weaken and eventually may fail. This is referred to as right-sided or right ventricular heart failure, also known as cor pulmonale. Cor pulmonale, all right? Remember that. Right-sided or right ventricular heart failure is also known as cor pulmonale. Don't let them get you with these terms. After the blood is oxygenated in the alveoli of the lungs, it returns to the left atrium, all right, via the pulmonary veins. So the blood is now oxygenated and is going back to the heart from the lungs. It goes to the pulmonary veins first, then moves to the left atrium, all right, or atria. The blood in the left atrium is then ejected through the mitral valve, also called the what? Bicuspid valve, all right? The bicuspid valve. So it goes from the pulmonary veins, then to the left atrium, from the left atrium to the mitral, aka bicuspid valve, and then into the left ventricle upon contraction of the atria, all right? On the next ventricular contraction, the blood is ejected through the aortic semilunar valve and into the aorta itself. The blood is then distributed throughout the body to cells and organs. The pressure in the aorta is very high. Therefore, the left ventricle must generate a significant amount of force to eject the blood against this pressure. If the pressure in the aorta is excessively high blood pressure, they talking to you. If the pressure in the aorta is excessively high, as seen in severe, did I just say? In severe hypertensive patients, what is hypertensive? Hypertension, high blood pressure, okay? Hypertensive patients, those with very high blood pressure in parentheses, or if the blood pressure is simply higher than normal over a long period of time, then the left ventricle will begin to weaken and fail. That's the problem with the high blood pressure. They just gave you that in there too. Also, if the left ventricle muscle is damaged due to a blockage of a coronary artery, the ventricle will weaken and will not be able to pump an adequate amount of blood out of the left ventricle. This may lead to congestive heart failure, also known as left-sided or left ventricular failure. All right. And the left ventricle cannot eject the blood effectively. Pressure in the left atrium and pulmonary veins begin to build up. This may force fluid out of the capillaries around the alveoli of the lungs. It forces fluid out because the capillaries are what? Permeable. That's the word you're looking for. Causing a severe gas exchange problem leading to what? Everything leads to hypoxia and severe shortness of breath. This condition is known as pulmonary edema. It is important to note that older adults are not the only ones to suffer from heart failure. An 18-year-old who has been using cocaine may suffer heart failure from severe vessel constriction that drastically increases the blood pressure and causes the heart to fail. Also, a young person may suffer a heart attack that destroys a portion of the heart muscle, leading to heart failure, cardiac rhythm disturbances, or sudden cardiac death. I don't know if y'all heard me, but they were saying that an 18-year-old who has been using cocaine may suffer heart failure from severe vessel constriction that drastically increases the blood pressure and causes the heart to fail. All right? Moving on, the vessels. Let's talk about the vessels now. The arteries carry oxygenated blood to the arterioles. All right, the arteries onto the arterioles and then to the capillaries, which interface with the cells throughout the body. Capillary walls are so thin that oxygen and nutrients carried in the blood are able to move out of the capillaries and into the body cells. What do they call that? They call that permeability or permeable. The capillary walls are permeable because things can move in and out through the walls. All right. The exception to the rule that the arteries carry oxygenated blood is the pulmonary arteries. Got it? The pulmonary arteries do not carry oxygenated blood. That's the only, all right? That's the only ones, though. The exception to the rule that arteries carry oxygenated blood is the pulmonary arteries, which carry deoxygenated blood. All right? The arteries carry oxygenated blood, all except the pulmonary arteries, which carry deoxygenated blood from the right ventricle to the lungs to be oxygenated. All arteries, however, carry blood away from the heart. Got it? Good. The veins carry deoxygenated blood from the capillaries where the blood has picked up carbon dioxide and other waste products given off by the cells through the venules to the veins and back to the right ventricle through the inferior and superior vena cava. Again, the exception to the rule that veins carry deoxygenated blood is the pulmonary veins. Huh? Got it? That veins carry deoxygenated, again, the exception to the rule that veins carry deoxygenated blood is the pulmonary veins. The pulmonary veins carry oxygenated blood. The exception to the rule with the arteries, the pulmonary arteries carry deoxygenated blood. Don't sleep. And back to it. However, all veins carry blood toward the heart. All veins carry blood toward the heart. There are many arteries and veins, as well as smaller arterioles and capillaries and venules that circulate blood throughout the body. Coronary arteries. The heart perfuses itself first with oxygenated blood before sending the oxygenated blood on to the arteries throughout the body. The coronary arteries are the first two arteries to originate off the aorta and are the same arteries that are associated with many cardiac emergencies. These two arteries branch off from the base of the aorta and are responsible for supplying the heart with a rich supply of oxygenated blood. The heart gets its blood supply from the coronary arteries, not from the blood that is pumped through its chambers. Got that? The heart gets its blood supply, that is, from the coronary arteries, not from the blood that is pumped through its chambers. Dig that. The heart is a muscle that requires a constant supply of oxygenated blood to continue pumping effectively. A good analogy to this concept would be to place a tourniquet around a person's upper arm and ask them to lift a 10-pound weight continuously. How long will he be able to lift the weight before his muscle begins to fatigue without an adequate supply of oxygenated blood? He will not be able to lift the weight for very long at all. Once the tourniquet is removed, the muscle will begin to function adequately again. The concept is the same with the coronary arteries. If a large coronary artery is blocked, it is unable to supply an adequate amount of blood to the heart muscle. Eventually, if the occluded or blocked coronary artery is, eventually, if the occluded coronary artery is not open or unblocked, the heart muscle will become hypoxic and begin to die. Everything becomes hypoxic. Don't sleep. During the ensuing ischemic process, the muscle may weaken and lead to a heart attack or heart failure, or the muscle may become irritable and cause abnormal electrical cardiac rhythms, some of which may be lethal. The blood. The blood is composed of several components that serve multiple functions throughout the body. That serve multiple functions for the body. The liquid portion of the blood, the serum, serves as the transport medium for the formed elements. The formed elements include the red blood cells, which, among other functions, carry oxygen to the tissues of the body. There are also white blood cells that serve to protect the body, and eliminate infections from viruses or bacteria. Platelets are old fragments of destroyed red blood cells whose job it is to help in the clotting process to stop bleeding. These functions of the blood also play a major role in cardiac emergencies. The most significant function in a cardiac emergency is the coagulation process. Blood components respond to injury by forming clots in order to stop the bleeding. The clot that is formed is called turning the page, thrombus. Several components are involved in the clot formation system, the most important of which are platelets. What are platelets? Platelets are disc-shaped elements in the blood that are fragments of cells from the bone marrow. Thrombin. What is thrombin? Thrombin is a protein responsible for activating the formation of a clot. And fibrin. What is fibrin? Fibrin are strands that are responsible for making the clot stronger. A thrombus may form within a coronary artery at a site where plaque, what is plaque? Plaque is a fatty deposit, has built up. The thrombus or clot formation develops in the following way. A plaque deposit inside the coronary artery may weaken over time and rupture. The body views the plaque rupture as an injury. And what does the body do? Defends itself. The body views the plaque rupture as an injury and sends out a cascade of substances to form a clot to stop the bleeding at the injury site. Platelets begin to cover the site, and thrombin is activated to form a clot. The clot may partially or completely occlude or block the coronary artery, cutting off or reducing the supply of oxygenated blood to the heart muscle. So you don't attack your heart. Your heart doesn't attack you, you attack it. The heart muscle becomes deprived of oxygen and may eventually begin to die. This may lead to a heart attack, attacking your heart, pump failure, or serious cardiac rhythm disturbances. Let's talk about cardiac contraction. Cardiac contraction. The heart's electrical impulse is first generated in the right atrium at the SA node, sinoatrial node. It travels through both right and left atria by way of the Bachmann bundle. Both atria contract simultaneously as a result of the electrical impulse, a process known as atrial systole. All right? Atrial systole. Systole means work. Ejecting the blood into the ventricles through the atrioventricular valves that open when the pressure in the atria exceeds the pressure in the ventricles. The impulse then travels to the AV node by way of the intranodal tract, located in the area between the atria and the ventricles. Y'all gonna have to pull up some pictures and look at this shit. There, the impulse is inhibited very briefly to follow the blood from the contracted atria to fill the ventricles. And then the impulse travels down the bundle of His, is how it's spelled, to the left and right ventricles via the left and right bundle branches. Telling you the blood flow cycle, all right? From the bundle of His and the left and right bundle branches, the electrical impulse travels to the Purkinje Fibers. I'm sorry, I said blood flow. They're telling you about the contraction of the heart, Purkinje Fibers, which are embedded in the ventricular muscle, causing the ventricles to contract simultaneously, a process known as Ventricular Systole, or ventricular work. All right, it's working. As pressure rapidly increases in the ventricles, it first causes the atrioventricular valves to close. When the pressure exceeds that exerted on the semilunar valves, they open and blood from the right ventricle is propelled toward the lungs, while blood from the left ventricle is propelled throughout the body via the aorta. Oh, well, it is telling you. It's telling you about the contraction, but along with that contraction, the blood is flowing. If you didn't have that contraction, the blood wouldn't flow, of course. So, bada bing, bada boom, there it is. If the heart rate and force of contraction need to increase or decrease based on the body's demand, the autonomic nervous system facilitates this modification via the sympathetic and parasympathetic nervous systems, as described previously. After the systolic phases of the atria and or ventricles, there is a diastolic phase. What are they telling you about? Blood pressure, okay, in which the heart cells repolarize and await the next impulse, as described in the next section. When the coronary arteries are occluded, either partially or completely, the conduction system may become irritable from the lack of oxygen. When this occurs, the conduction cells may begin to fire off impulses on their own. This may lead to cardiac rhythm abnormalities called what? Dysrhythmias, because they offbeat. All right? Dys means what? Difficult. Rhythm, of course, is rhythm. But anyway, difficult rhythms, all right? Some of these dysrhythmias may lead to sudden death. The electrocardiogram. The electrocardiogram, or ECG or EKG, is a graphic representation of the heart's electrical activity as detected from the chest wall surface. When they put those little things on your chest and on your sides in the hospital, that's the EKG or ECG, the electrocardiogram. The ECG may be displayed on a monitor screen or on a continuous strip of special graph paper that can record changes in heart activity over a period of time. Each heartbeat or mechanical contraction of the heart has two distinct components of electrical activity: depolarization and repolarization. Depolarization is the first, all right, in which the electrical charges of the heart muscle change from positive to negative and cause heart muscle contraction. Depolarization causes heart muscle contraction. Repolarization is the second component in which the electrical charges of the heart muscle return to a positive charge and cause relaxation of the heart muscle. The human body acts as a conductor of electrical current. Any 2 points on the body may be connected with electrodes or electrical leads to record the heart's electrical activity. The recording or tracing of this electrical activity produces a graphic representation of depolarization and repolarization in the form of complexes or a series of waves, catch that wave, normally occurring at regular intervals. The waves or deflections of a normal ECG or electrocardiogram have three portions. What are these three portions, you ask? I'm about to tell your ass. The P wave. This is the first waveform of the ECG and represents the depolarization or contraction of the atria. QRS complex. The QRS complex, this is the second waveform, and this waveform represents the depolarization, contraction of the ventricles, and the main contraction of the heart. Then you have the T wave. The T wave, this is the third waveform, and the T wave represents the repolarization or relaxation of the ventricles. All right? The atria also have a repolarization wave, but it is usually hidden within the QRS complex. Another portion of the ECG, the PR interval, also referred to as the PRI, is measured in terms of time and used for the analysis of the ECG. The PRI is calculated from the beginning of the P wave to the beginning of the QRS complex. It represents the time it takes the heart's electrical impulse to travel from the atria to the ventricles. All right, got that? The PRI represents the time it takes the heart's electrical impulse to travel from the atria to the ventricle. It's not that important, but it is. The main three, of course, are your P wave, your QRS complex, and the T wave. In a normally functioning heart, as described earlier, the heart's electrical impulse is generated from the what? What is the heart's electrical impulse generated from? What have I taught you so far? Tell me now. Oh, shut up. The SA node, all right? If you got it right, you go. The SA node, the sinoatrial node. The electrical impulse then travels through the heart's conduction system, depolarizing the muscle and producing the contraction that pumps blood into the ventricles and then through the body. This electrical activity is called normal sinus rhythm. It will produce an ECG pattern of regularly spaced peaks that occur between 60 and 100 times each minute, separated by nearly flat lines. In some cases, the heart muscle becomes what? Hypoxic. Everything becomes hypoxic. Is injured or dies. Also, the electrical conduction system may be damaged or disturbed and may cause the improper functioning of the heart. Sometimes these conditions produce an irritability of the heart that causes the uncoordinated firing of electrical ventricular impulses called premature ventricular complexes, or PVCs. We ain't talking about the pipes. We're talking about premature ventricular complexes, all right? When PVCs occur in succession, meaning after each other, of course, they may produce ventricular tachycardia, or VTAC. Your heart beating fast as hell. Ventricular tachycardia, all right? Which shows up on an ECG as steep peaks and valleys that are very close together. Why? Because it's beating fast. It's going up and down fast as hell. Boom, 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 boom. If left untreated, ventricular tachycardia can degenerate into ventricular fibrillation, all right? Remember, it's degenerating at that point. It's going down, all right? So your heart beating fast as hell, and then it's going into ventricular fibrillation after that. VF or VFib, which is, ventricular fibrillation, which shows up as smaller, uneven, disorganized peaks and valleys. It's all over the place at that point. It's trying to stay alive. Blood pressure. The blood pressure is the amount of pressure exerted against the arterial wall during circulation. Y'all don't talk about me because I'm going to always say that L at the end of arterial. All right. Anyway, wall during circulation. The systolic blood pressure is the measured force exerted during the contraction of the heart, whereas the diastolic blood pressure is the pressure inside the artery when there is no contraction. You got that? Let's say that again for you slow folks out there. The systolic blood pressure is the measure of force exerted during the contraction of the heart, meaning, when the heart is contracting, all right? When the blood is going through, then that's when you measuring your systolic blood pressure, all right? The diastolic blood pressure is the pressure inside the artery when there is no contraction, or when there is no blood going through, or between contractions of the heart, is Yeah. The vessel's size plays a major role in the blood pressure. A smaller sized vessel will offer greater resistance, resulting in what? A higher pressure, of course, because they're smaller. It's exerting more pressure because they're small. Thus, vasoconstriction, constriction of the vessels is vasoconstriction, will increase vessel resistance and blood pressure. Conversely, the larger the vessel size, the lesser the amount of resistance and the lower the blood pressure. Makes sense, right? Don't let these words throw you off. Vasoconstriction. Constriction, all right, of the vessels. Vessel, all right? Vasodilation, which is dilation of the vessels, dilate, it gets bigger, will cause the resistance to decrease and the blood pressure will fall. Vasodilation, vessels bigger, all right? They get wider. Vasoconstriction, the vessels constrict and get tighter, all right? Don't forget that. All right, inadequate circulation. A properly functioning circulatory system delivers oxygen and nutrients to the body cells and carries away carbon dioxide and other waste. So don't forget that carbon dioxide is a waste product. You know that. Anyway, these processes take place as blood passes through the capillaries. Why? Because the capillaries are what? Permeable. That's why it takes place, because they seep out through the capillaries. That's where the waste gets, eliminated. Anyway, the delivery of oxygen and nutrients from the blood through the thin capillary walls into the cells, message, they just said it, what I just said, and removal of the carbon dioxide and other waste is known as perfusion. Perfusion. Don't you forget it. Perfusion. Perfusion. Perfusion is the delivery of oxygen and nutrients from the blood through the thin capillary walls into the cells and the removal of carbon dioxide and other wastes. All right? That's what the perfusion process is. Period, point blank. Under some conditions, blood does not circulate adequately through the body's capillaries. The chief result of inadequate circulation is a state of profound depression of cell perfusion called shock or hypoperfusion. Hypo, low, perfusion, that's the process we just discussed. All right? So a lack of perfusion sends your ass into shock. All right? The cells become starved for oxygen, which is what? Hypoxia. Hypo and, oxia, oxygen, hypo, low. All right? The cells become starved for oxygen, hypoxia, and nutrients and become overloaded with what? Carbon dioxide, CO2, and other waste products. Hypoperfusion can occur as a result of low blood volume. Low blood volume, hypo, low, volemia, volume, the emia, hemia, blood, all right? Break it down. Hypovolemia, low volume blood, but low volume blood, low blood volume. Insufficient, let's start at the beginning. Hypoperfusion can occur as a result of low blood volume or hypovolemia, insufficient pumping action of the heart failure, or dilated vessels, vasodilation, that may also be leaking. Hypoperfusion from massive vasodilation can also be caused by spinal cord damage that interrupts innervation of the blood vessels in the absence of stimulation. You got that? So it's an interruption of electrical activity. All right? In the absence of stimulation, the smooth muscle in the blood vessels relaxes, which results in massive dilation of the blood vessels, creating a vascular system that is too large overall for the amount of available blood. All right, folks, I hope I didn't bore you to death. That there is the achy breaky heart and the circulatory system, its anatomy and physiology, all right? Take that, go to sleep with it, listen to it while you shit, while you drink your tea, while you eat bowls of cereal, and while you sleep. Study buddy, out.